First, I had the plan to start a hospice like Sparsh. But having served my wife for 10 years, right from 2005 to 2014, and her dying in my hands because of cancer, I thought I could not really take bold to go and then start a similar thing. This is my story. Subsequently, I had colon cancer, survived, and today I'm here with you, only to prove that cancer will not take you to death. You can survive and survive like me. This is one message I want to give. Now coming back, having suffered, even now I am suffering. My 2 children are in the US, right? I am here alone. I think of, I breathe cancer. I talk of cancer. I don't have any other work. Only giving a message. This is what I do day in and day out. I never wanted to go abroad and live with my children. I stay in India and see that my people are saved. Now, coming back, we started this particular thing because people like me, we are about 5 or 6 people who suffered because of cancer directly or indirectly. We started an NGO. I worked with Basav Tarakam. We did similar camps in Maldives. Madam Kalpana also was part of the team at that time. We also did in Andaman Islands, where even today the situation is very bad. And remote places we did. And we understood that the gap, why people are dying, is because they do not know what cancer is, and they do not have enough facilities for immediately early detection of cancer. Even today, we don't have them in Telangana. None of the district hospitals have got the facility where you can really go have a cancer screening. This is the unfortunate situation. But still, what we do is, we have developed about 6 or 7 videos, one on menstrual hygiene for the girl children, one on cervical cancer, one with Dr. Swastava on tobacco, how it causes cancer, how many cancers are there. We developed so many awareness videos to start with. And then we started getting into the field, go into the villages, talk to them about it. None of them know what cancer is. And unfortunately, there's a big taboo. If there's anybody who has got cancer in the family, I fear that my daughter will not be married, right, to any family. And my son cannot be married, nobody will give a daughter. See, this is the unfortunate thing because, right, well, good question Swastava was answering. People do not know that cancer is not contagious. My cancer is my cancer, your cancer is your cancer. This is something we should be able to tell them. This is where the life is. People think after cancer, there's no life. Once it comes, the collapse with the fear. You know, snake bite, many people die because of the fear and not because of the snake venom. Yes. Cancer is like that. People die because they think the cancer will kill them and then they sink. This is another thing where we need to take a message. Now, coming back, you can see we almost covered about 62,000 people in Telangana and in Karnataka, only giving awareness in rural areas, and about 42,000 women we screened. We have taken the sample of women only. Oral, breast and cervical cancer we do, right? We don't stop just by screening. We do post-screening investigations required. If required, we get cervical cancer, cervical biopsy done, but then mammogram done and oral biopsy done. And then admit them, because many of the private hospitals do not accept, because there is no provision in Argyashri for post-screening diagnosis. So if I leave somebody who is poor, you get the diagnosis done, they cannot do. They'll forget about it and they will die. So we complete the diagnosis and admit them in the hospital, follow up at least for about 2 or 3 months till the time the treatment goes. My great sincere thanks to Swastava Garu. We have already come to an understanding that from the time of screening, if any people are there, we can send them directly to MNJ Cancer Hospital, where Cancer Hospital will take care of things. This is a great boon. I wish you give a big applause to Dr. Swastava for his kind gesture. Now the third, see, we run on 4 verticals. One is awareness. Second is screening for breast, cervical, and oral cancer. The third one is menstrual hygiene, physical hygiene, and tobacco. We make the children take oath on that they would not touch tobacco. And fourth one is HPV vaccination. Sir has already told there is only one vaccination that can prevent the virus. That is HPV vaccine. Unfortunately, it is not known to many. There is a lot of vaccine resistance, and awareness is totally zero. I went to a medical college to address like this. When I asked them about COVID vaccine, they said everyone has taken 2 or 3. When I asked them, did you take HPV vaccine? One innocent girl got up and said, what is HPV vaccine? That is the situation in which we are now here. So these are the 4 verticals we take. We go to schools and all that and talk to them about 1,500 girl children. As he rightly said, 9 to 15 girl children only we were giving. It is very unfortunate it is still not included into the national immunization program. I'm sure something will happen in coming months or years. Now in the Western US, they give for boys and girls. The reason you will know when we go to the next slides. This is one excellent program we are conducting on the 11th. If any one of you can come, please come. This is what we are doing for positive women. Generally, you should not say HIV people. You should only call positive. That is what the norm is. So we have used only positive. We are screening about 100 positive women, right? With the help of MNJ Cancer Hospital, we are doing it. Thanks to you, sir. And we will be on the 11th. If you have time, please note down the venue and come down. You'll be able to really see it. 10 o'clock. This is how we do the registration. You know, every woman who is being screened, I don't want to call them patient till the time it is detected. Every woman who comes is an incumbent, and we take approval acceptance from them that I have understood what the screening is going to be, and I'm willing to do that. We take their signature or thumb impression, and then only we proceed. That is what the registration goes. We take, of course, some vital details that are required. Then this is how the cancer screening goes on, registration and all that. Cancer awareness and screening, some of the doctors speak about various things besides what we do. And we take our TV and show the screen, because LCD projector, if there is a lot of light, they can't see properly. That's why we carry our TV and show the videos to everyone. This is one of the ways we do. We have a special program known as Reach Them Young. Going to schools, talking to children about tobacco and cancer, talk to them about drugs, alcohol. Also talk to the girl children about menstrual hygiene. In recent past, we did a program for the NCC cadets. You know, the girls came and said, sir, you are doing injustice to us. You should conduct the program along with the boys, because boys should know. Their mothers bleed, their sisters bleed, they do not know. If there's any spotting happens while we are at school, they hickle at us. They do not know. So please see that this class is given to boys and girls so that they will understand the anatomy and how it is happening and why it is happening. I appreciate it very much. Then I stopped segregating them. We are giving it to both boys and girls. So this is our regular program. Reach Them Young. That is medical college where I was addressing and asking them. I don't want to name the college anyway. Well, these are, I'm sure all of you know that these are all the cancers that can come. Oropharyngeal cancer, pineal cancer, vulvar cancer, vaginal cancer, anal cancer, and cervical cancer. It is not just for the girls. Even boys are there, though it is sexually transmitted disease, virus. Boys also should be protected. That's why we started giving it to boys and girls. We are not giving it to girls only. We are giving it to both boys and girls. Now, cancer awareness. On a HPV day, there is one World HPV Day. We take a awareness walk in the city or in the suburbs so that people will come to know what HPV. Awareness creation is a very important thing. We are talking about that only. Now, this is about breast cancer walk. Every year, positively, in the month of October, we conduct a walk on breast cancer. And on World Cancer Day, we do World Tobacco Day we do, this type of awareness we create, but in a very limited way anyway, because it's only for about 4 or 5 kilometers we take them. Thanks to FTCCI, they have recognized us and then gave us an award saying that we are one of the people in prevention of cancer. Thank you very much, sir. And then, as I told you, these are the 4 verticals we work. One is awareness, second is the screening, third is menstrual hygiene, fourth is HPV vaccination. And we are now introducing thermal ablation. You know what is happening? We are only worried about cancer. But if there are infections, they just go away. Suppose there is a pre-cancer lesion. We tell them to go to the hospital. That hospital may not have the facility, unfortunately. I don't want to talk about government and the government hospitals. Many hospitals do not have the facility. So they do not go. And the infection goes up. They will become sick. That's why, jointly with MNJ Cancer Hospital, on the spot we are going to give thermal ablation so that it can really cure the lesions. This is one I wanted to show you specially. This is a big mammogram van which has got a facility of X-ray. Now, HIV men or women are more prone for cancer and tuberculosis. So we have facility to check cancer, cancer and also tuberculosis because X-ray is there. This van, we did not leave the van. If you see, we were talking about the HPV. Most of the cars follow, they read that. That's the reason we gave it on the rear, because awareness creation on HPV is a must and essential. This is a colposcope, what we use during that, and subsequently hand over the images to MNJ so that they can do colposcope guided biopsy. This is a special instrument that has come into the market now. This is known as smart scope, where on the spot, with the artificial intelligence I was talking about, it can detect cervical cancer. If it is red, it is positive, amber on the border. If it is green, safe. We are using it. Of course, the sensors are very expensive, but still, one sensor can be used only for one woman. Even then, we are using it, and we are getting very good results out of this. This is where we try to, every year, NCC, they conduct a program. About 700 to 800 children come from all over the state. We address them, we talk to them about tobacco, make them take an oath that they will not touch. They will also see that the tobacco habit, anybody smoking, they will stop. Their family, the society, the village, all this, we make them take a pledge. And then also talk to them about hygiene and other things. This is what a special program where it is really paying and doing a lot of good. This is one menstrual hygiene program. We distribute biodegradable pads because disposal of the used pads has been causing a great menace. Everyone knows about it. They throw it on the road, dogs and cats pull them out, and the flies on that will also reach our kitchen. Nothing can be helped. So we are giving them biodegradable menstrual pads. We tell them, dig a pit, bury them so that it is done with. So this is what we do. We go to every school and then talk to them, residential school also. Well, let me end saying that early detection can save lives. Yes, this is a mantra. I still remember, I'd like to tell you something, which I was talking very fondly with our friend. In my childhood, there used to be only radios. We never had TVs and all that. Early morning you start, we used to get humming, mummy, mummy, modern bread, if you remember. Do you remember that? I think cancer awareness, jointly, Federation, MNJ Cancer Hospital and Swastava, we can take up and then see that this type of jingles are given in the radio and TV, where, did you get your cancer screening done? Did you get your children vaccinated for HPV? If we can start doing that, then I think we'll be able to bring awareness, at least in people, who will be able to save a lot. Thank you so much for giving this opportunity.